Full mouth reconstruction is a process where we take somebody who has worn teeth, multiple extensive issues with either their teeth or their gums or a combination of them. The treatment process for full mouth reconstruction is very intense and complex. One of the first things that we do is we take a lot of records in terms of pictures, impressions, digital scans of your mouth. Then I will sit down and take a look at all the different issues that present themselves, and then I'll begin to put together a master game plan on all the pieces, parts, and processes that we will need to accomplish in order to make that transition. The benefits of a full mouth reconstruction are many. Number one, we take somebody with worn down dentition or broken down teeth or infection, etc., and then we're able to rebuild their mouth so it functions properly. A lot of times people that are seeking full mouth reconstruction have had a lot of dental work in the past and a lot of patchwork of dentistry where they'll have some crowns done here, crowns done there. 2 or 3 years later they would have something else done, and then all of a sudden they have all this dentistry in their mouth that doesn't match, it doesn't function together well, and it begins to break down. And so I see a lot of patients that have an extensive history of dental work that's just no longer working like it's supposed to work. And those are the typical types of patients that we see that seek out full mouth reconstruction. Most of our patients understand that getting into a full mouth reconstruction, they're going to be spending quite a bit of time in the dental office. So you've got to like your dentist, you got to like the team members, you got to like the office, you got to have a good time in the environment, you got to feel comfortable in the environment. And so that's one of the things that we foster here in our office, is an environment that people feel comfortable here, and they always end up very excited and happy with their decision to have us help them with their full mouth reconstruction.